Good evening, everyone, and welcome and thank you for joining us for today's Scrutiny Children's Services Review Group. My name's Lee Bridgen. I'm the chair of the committee. I'll just run through the pre-meeting announcements. So this meeting this evening will be live streamed to the public. A recording of the public part of the meeting will be available on the council's website within 24 hours of the meeting. Remote participants joining the meeting using Teams, please turn cameras on when speaking and use the hands up icon to indicate a question or comment. Turn microphones and cameras off when finished. Those in the chamber, please remember to switch microphones on when speaking and speak directly into the microphone and turn off when finished. With attendees in the chamber, please switch mobile phones off or place them on a silent mode. If you need to take a call, please leave the room and return when finished. And on that note, I'll just make sure I've got mine on silent. Yes, okay. Right, so moving on to the first item of the agenda. My laptop catches up. So first item of the agenda is apologies for absence. So I've had apologies for absence from Councillor Jeff Petts and Councillor Clive Mead is kindly substituting today. Have there been any others?
Katie Thompson from the primary school and also Joe Miles from the secondary school.
Thank you. Any other apologies from anyone? No. We'll move on to the next item, which is to confirm the minutes of the last meeting, which was held on the 10th of January 2024. The minutes have been duly circulated with the agenda pack. Does anybody have any comments or corrections for the minutes? No, all fine. So those are confirmed. Thank you. Moving on to the next item, which is item 3, disclosures of interest. So I will start by declaring that I am a governor of Summaries Junior School. I think Councillor Khan was first in.
Governor at Dallow Primary School.
Thank you. Councillor Abbas.
Governor at William Austin Junior School.
Councillor Keynes.
Oh, all right. Governor of Queen Elizabeth School and virtual school. Now, this brings me to a point. As I'm a governor of a virtual school, and there is a report from the virtual school, do I stay? Do I go? Pardon? I'm all right. Okay. Thank you.
Thank you. I don't see any other hands up, so we shall move on to, let's scroll down, the next item, which is urgent business.
I think Raj wants to say something.
Oh, my apologies. Thank you. It's, yes, thank you. I was struggling to read that. Sally?
Hi, apologies. It's not declaration of interest. I'm just checking on my papers. And is the CDOP annual report on the agenda today? Have I got confused? Apologies.
The child death report, yeah?
Yeah.
Yeah, yes, it is. It's under item 10.
Oh, maybe I'm... Is it in the papers? Am I looking at the wrong thing? I can't. It's not in my paper pack. It's on the agenda though, is it?
Yeah, it should be on page 118.
Okay, that's fine. Is there any chance that I can present that earlier on the agenda? Would that be okay?
Yeah, certainly. That would be fine by me. Don't see. Yeah.
Great. Okay. Thank you. Apologies.
Okay. Thank you. So item number 4 was urgent business, which I don't have nothing reported. Under item 5, references from other committees and other bodies.
None, Chair.
Under item 6, a chair's update. So some of you may be aware that the former interim service director for children's operations, Teresa Gallagher, has left Luton Borough Council, and I think it'd be right to place on record our thanks for Teresa's contributions and commitment to the achievements of the council. And also, I don't think we've yet welcomed Teresa Hills, who is the new service director for children's operations. Sorry, go ahead, Dira.
I think she has been to Scrutiny once, and then we also have a permanent appointment for the Service Director for Quality and Improvement, Janice Altonov.
Thank you, Dirash. I wondered whether we had, but I didn't want to be remiss and miss it. So thanks for confirming this. Finally, some of you may be aware that this meeting is regularly clerked by Bert Seong. I think this would have been his last meeting before his retirement. So certainly, I think we should place on record our thanks to Bert for his contributions to the well running of these meetings. So that's that completes my updates. I think perhaps given Sally's request, maybe if we run through item 7 first, and then we'll skip forward to the child death report, if that's okay with everyone. Yeah. So we'll start off with item 7, the virtual school annual report.
Thank you very much. I'm here on behalf of Matthew Sims, Virtual School Head. Unfortunately, he can't be here today. I'm Michelle Wright, the Education Manager. So the report is an overview of Luton's virtual school, the work during the academic year 2022 to 23. To clarify, we're a team who champion education for our young people who are in care to Luton, our care experienced and other vulnerable young people. Our title's quite misleading. We're not virtual, we are living and breathing, and we're not a physical school. We are champions of education. The first part of the report highlights our primary and secondary looked after young people. Some points I think to pull out on notes is that 46% of our cohort, so 106 looked after young people, were educated in Luton, compared to 53%, so 122 educated outside of Luton. And this trend has been similar over the past 4 years, and may be due to the lack of available foster placements to support our young people remaining in Luton and being educated in Luton. 93% of our young people attend schools that are Ofsted good or outstanding, and this is one of our key performance indicators, and it's one of the factors we consider when we are securing a new school place for our looked after young people, along with their views and the carers' local knowledge. We have 28%, so 65 young people of our cohort who have education healthcare plans, and the most common primary need is social, emotional and mental health. And the majority of the young people with education healthcare plans are educated in mainstream schools. We did have 17 young people on part-time timetables. We closely monitor this, and we ensure we're looking at increasing their time in education, and we look at bespoke interventions to encourage their attendance and work closely with schools. 84% of our young people had attendance of 90% or above, which is comparable to last year. We monitor attendance closely by a company called Welfare Call, who provide attendance data on a daily basis, and we investigate any dips in attendance. We had 27 young people, so 12%, who had 1 or more suspensions, and a slight increase compared to last year, but we haven't had any permanent exclusions, and that's a trend that has been the case for the past 5 years that we're really pleased to report. And we work very closely with our schools to try and avoid suspensions and looking at interventions that can be used to assist the young person with remaining in the learning environment. 97% of our personal education plans were completed within time. Personal education plans are held termly and are part of the young person's care plan, and the virtual school liaises closely with the education setting, the young person, carer and social workers to ensure appropriate supports in place to increase positive outcomes, progress and achievements. We receive Pupil Premium Plus funding from the Department for Education for our looked after young people. We send the majority of this into our schools since they are able to support the needs of the young person and know best where to plug any gaps. However, we do top slice some of this funding and we use the majority for one-to-one tuition for our targeted year groups in year 5, 6, 10 and 11 with the aim of closing any gaps in their learning and helping them feel more confident in their SATs, their Key Stage 2 SATs and their GCSEs. We have found that a stable foster placement, a stable school placement and the one-to-one tuition does increase their chances of achieving and attaining better grades. With regards to data last year, we had 7 of our year 6 young people achieve age-related expected levels in reading, writing and maths. And we had 4 of our young people in year 11 who obtained grade 4 or above in English language, maths and science. It's useful to note that children come into care at different ages and stages of their lives and may not have had good attendance previously or the encouragement to do their best at schools. And our focus is to reduce any barriers to their learning and close any gaps in their learning, working closely with our schools. With regards to our 17 and 18-year-olds, 92% were in education, employment and training, which was an increase compared to last year, but the figure does decline to 60% for our young people aged between 19 to 25 years of age who are care leavers. With regards to Pupil Premium Plus funding for our post-16-year-olds, we tend to use that again for tuition in English and maths for their GCSEs if they haven't gained a grade 4 or above while at school. And we also use the funding to employ personal advisors from our youth advice team to provide support and advice to our young people to be in education, employment and training. We've also used the funding to secure an employment coordinator who's enhanced our weekly TOCO drop-in sessions where our young people can access advice and support for education, employment and training opportunities, obtain career and employment advice. And she's also developing key contacts with local providers and other agencies within the locality to ensure we have opportunities to promote education, employment and training for our 18+ young people. We do hold regular not in employment, education or training plan meetings with our young people who are NEETs, and we always try and ensure that they have the opportunities to follow up on any interests to get them back in employment and training. From September 2021, Virtual School have extended duties. So it's now a Children with a Social Worker project. So we have strategic responsibility to reduce the barriers to education for this cohort of students, which include children who are on child in needs and children who are on child protection plans. And it's with the aim of increasing positive educational outcomes. We've used this funding that we've received to provide mentorship and sporting activities at Luton schools using our partners Active Luton and Luton Town Football Club. And this provides young people with an incentive to come into school and also ensure that the young people are visible to professionals within the education setting. We've also funded trauma training for some of our Luton schools, and along with our educational and psychology colleagues, we promote the emotional literacy support assistant training programme to schools to ensure that the teaching assistants are equipped to support the emotional needs of young people in the learning settings. We work collaboratively with our social care colleagues, and we're empowering them to be able to challenge education issues at SIN and CP meetings. And we also provide consultation and advice when requested. We feel our priorities for this year is ensuring that our Children with a Social Worker project, we can show the impact of all of the interventions that we've put in place. With regards to Pupil Premium Plus, we want to continue to employ the youth advisors and reduce the number of NEETs in line with the council's Needs of Education plan. And we also want to ensure that our personal education plans that we have for our young people, that they are effective. And we have used the audit team within social care to do some quality assurance for us. And we're working on the points that they've raised to make sure that the PEPs are an effective working document to ensure our young people have the option to do their very best in whatever setting they choose. That's the overview. Happy to take any questions.
Thanks very much for that overview. Any questions? No. Councillor Mead?
Thank you, Chair. As you may have noticed, I'm not regularly on this panel, so I'm ignorant of the way things work. But my question is, do our children have a named mentor who they can turn to if they have any issues, problems, etc., etc.? Right.
Of course. So within our schools, there is a role called the designated teacher for looked after children, and it's their responsibility to ensure our looked after children do have someone to go to in schools if they have any issues, worries or concerns. And we support the designated teachers through training and advice, and we do that on a regular basis. So we're hoping that our young people do have someone to turn to when they do need support.
Thank you.
Thank you.
Councillor Abbas?
Thank you, Chair. I was looking at a table for Key Stage 4 results, GCSE results, and there were quite a number that below a grade 4, and there were quite a few no grades. I was just wondering, how much do you make use of functional skills assessments, and do you use them at all?
Thank you. Yes, our young people who we know may not get the required standard of a GCSE good pass, we do explore with schools if they can sit the functional skills in English and maths so that they do actually leave year 11 with something to their name. And obviously we would then encourage them to go on to college where they could sit a level 2 course, and then English and maths would be part of their curriculum at college to help them achieve the GCSEs. So functional skills is something that we do ensure our young people have access to if they're not able to do the curriculum for GCSEs.
So can I assume that if they're not getting the grade 4s or GCSEs, they will be getting a functional skills qualification when they leave? Because I think it's quite important for these children, because they're amongst the lowest of attainers, to feel some sort of achievement.
Of course, yes. So we make sure that they do have the opportunity to sit GCSEs, but alongside that, they also are able to sit functional skills. And again, they have the opportunity to sit functional skills if they need to in college, as well as GCSEs.
Could I just add into that as well? Clearly, the children have a personal education plan, and it's revised on a regular basis, and that determines the kind of support that they need and the kind of pathway that the school then follows through. And I think the Pupil Premium Grant is linked with that plan. So I think that's where the detail comes through, so it's appropriate for each child.
Thank you for that. That leads on to my next question in terms of, I saw some BTEC results. So to what extent do we go to actually set up a personal educational plan and a bespoke curriculum? I know you have to teach the core subjects, but it's also with these children, it's worthwhile doing something that they're interested in, get them engaged, and then kind of they can flourish in the core subjects.
Of course. So obviously for our young people up to year 13, they do have the personal education plans. We always follow through with the interests and make sure when they go on to their further education, it is a course that they're invested in. And we hope that we can tailor they can attend a course that they really like to do, so we keep them engaged in education. So we're always looking for that golden thread of interest to keep them in education.
Just the last question. I mean, 53% are educated outside the borough, and you said it was due to foster carers. And that, and what do we do?
So we do work closely with our schools out of borough as well. We treat them as if they were in borough. We held the personal education plan meetings termly. We give support to the designated teacher at that school. For some children, they do need to be outside of Luton, but it is unfortunately a trend at the moment that there aren't sufficient local foster placements to keep those children who do need to be in Luton within Luton.
It's more about, are we looking to reduce that amount? Are we doing anything, maybe something more on the children's services side? Are we doing anything about reducing that, or are we doing anything around it?
So I think the question is about reducing the number of children being placed out of borough. So that's within our fostering sufficiency strategy, which I think is tabled for a future scrutiny meeting. If it's not, I think it probably needs to be.
And just to pick up that children who are looked after, whether they be fostered within the borough or outside, there is an equality in the experience that they get from the virtual school, so that they're still our children, so no matter how widely spread they are. Obviously, the schools are supported to make sure that these children can have their needs met.
Thank you. Any other questions or comments? Councillor Gallagher? Yeah.
Just going back to your training that you're talking about with regards to the attachment and trauma. At the moment, you've got 6 schools that are taking part in it. Is it going to be rolled out throughout the borough, or?
Yes, it is. We offer it to any school within Luton who would like that. It's something that we fund. We also have 2 specialist clinicians within our team who are able to deliver that training as well for after school sessions. So it is our aim that every school in Luton does receive that training.
Thank you. Any other questions or comments? I can't see any hands up anywhere. So the recommendation was to note the report, which I believe we duly do. And thank you for presenting it and answering our questions. So we'll move on to the next item, and we'll take which one was it? Item number 10. We'll bring forward to the next item. So the Bedfordshire Child Death Overview Panel, which is on page 118 of your agenda pack. I believe that would be page 122 if you're looking at the PDF. And that's with Sally Cartwright.
Thank you, and thank you for accommodating a change round. So the child death process, I'm not sure if this paper has come here before, but it's a statutory requirement. Just for background, the child death overview process is a statutory requirement, usually chaired by Director of Public Health, although not always. And for us, our child death panel covers the whole of Bedfordshire because there's a statutory requirement of the number of cases seen per year of a minimum of 50 if possible. So to make up the numbers and make it so you can identify patterns and trends and look for risk factors in a way that's not looking at really small numbers, it makes more sense to have a slightly bigger footprint. So this is a Bedfordshire wide paper, and the process is that once a child has sadly died, there's all of the other processes that happen, and right at the very end there is a child death overview panel on a case-by-case basis that looks at all of the factors related to that death, with all service providers and partners around the table to look at whether there's any learnings that could be made or any modifiable factors or service changes that could have been made. So it's part of a sort of an improvement process. And every year there's an annual report which looks at patterns and findings from the year and tries to make recommendations for action and changes across the system. So it's a whole system piece of work. So this is the annual report for 22-23. And there's two elements to the report. There is some analysis of the number of deaths overall across that period. So the 65 children died across Bedfordshire between 22 and 23. And then there's also an element of the paper that is around the numbers of cases that were reviewed through the panel, because it's the last step in the process. There will be more cases notified within a year than the number of cases that are actually seen throughout the year. So we might be looking at cases from previous years or even before that, depending on all the things that need to happen along the process before it comes to child death overview panel. So there were 65 deaths in the year and we reviewed 44 cases. We had to stand down 2 of our panel meetings because of doctor strikes. And I think, just trying to remember my years and the Queen's death, I think, in that year. But there was 2 times when we had to stand down the panel, so our numbers were slightly lower. So we're now working hard to make sure that we're seeing the right number of cases in this year to be able to show those patterns and trends. So looking at the demographics of the cases, both in terms of deaths in the year and deaths that have been reviewed, when you look at deprivation, there are more deaths depending on this higher risk of death in the more deprived areas. So if you look at the postcodes of those that have died broken down by deprivation decile, there are a higher number in the more deprived deciles of the population. And there's also an overrepresentation in Asian and Asian Pakistani groups compared to the population, the base population that we see in Bedfordshire. So both for deaths in the year and for deaths reviewed in the year, that pattern can be seen. Through the process, we look at modifiable factors and have a discussion about where factors could have been modifiable or are things that could be modifiable. So the ones that came up, particularly in the deaths that we reviewed, were maternal obesity during pregnancy. And this doesn't mean that it's the cause of death, but it's factors that are relevant and could have been modifiable during in the run-up or prior to the death. So maternal obesity, substance or alcohol misuse, access to services or triage, missed opportunity to delivery earlier in maternity, substance or alcohol misuse by parent or carer, housing, vaccination, consanguinity, so close relative marriage, and smoking. And that is aligned with the national picture as well, in terms of when you look at the national collation of all the child deaths, some of the key factors through those are smoking, quality of service, unsafe sleeping arrangements, substance misuse. So a lot of them are the same, but we're seeing others, the kind of order in which they come up is different for us in Bedfordshire. So the report goes through some actions that we have done over the last year based on some of the reviews, and then it makes recommendations for further work. Get me to my recommendations page. So the main things that I just want to talk through are the recommendations for ongoing work over the next year. So the action plan, which is on page 139 of the pack. So we're looking at sharing findings more widely and having more of the conversations with wider services around how people are viewing deprivation as a risk factor. So within health visiting services, hospital, for example, it doesn't mean that necessarily things always need to be put in place if you know that somebody's from a deprived area, but actually just having that cognizance of that being an increased risk factor for poor outcomes is something that we're trying to have more conversations about. In terms of consanguinity, we have received, or the NHS has received, some funding locally in Luton, particularly for a culturally sensitive genetic services for families and pregnant women to have culturally sensitive conversations about close marriage and what there may or may not be risks of, and how to have just informed conversations and informed understanding of what risks there may be through that. So we've appointed a community link worker, a genetic midwife, and that's now being set up. So that's through the local maternity services and linking in with the family hubs and linking in with public health, but it's an NHS programme. We continue to promote safe safe sleeping through the Lullaby Trust advice. And we continue to get updates from them at the CDOP meetings. We are looking at, so that a lot of the findings that come through CDOP are sort of public health related, hence it's very public health focused and tends to be chaired by public health. So some of the modifier factors are around smoking, obesity, and so we're doing a lot of work to try and ensure that the pathways of referral from maternity to those lifestyle services are really clear and happen as best they can, particularly around weight management services. We don't have great uptake of weight management services from maternity, and we're just trying to understand that a bit better as to why that is. Is it that midwives aren't having those conversations because of training needs, or is it because they're having the conversations but then they're not recording it, or is it because they are having the conversations, referring, and then those women just don't want to take it up? There's also a preconception service that's being set up, which is quite small numbers at the moment, but that will also then have those conversations even earlier and try and be promoting that weight management element as part of preconception. And then there's some other actions which are more related to some of the pathways between acute trusts and genetic services or metabolic conditions services, multi-agency training, and the designated paediatric doctor for CDOP looking at pathways for eye examinations between the acute trust. So less of the public health focus, but more of those acute pathways between community services and acute. So I'll stop there and open up to any questions.
Councillor Khan?
Thank you, Chair. Thanks, Sally. That's an excellent report. My question in particular is around the plan that you have devised for close relative marriage and genetic risk. I do know that in Luton, we do have a significantly high number of that, unfortunately. I wondered if a consideration has been made around speaking to community leaders like faith groups and so forth to try and raise awareness on this, because the numbers in fact speak for itself, you know, and I do think it's probably worth having those community leaders in on those meetings. I know it's really good we've got community links, but I think it would be far greater if we can have faith leaders kind of have these discussions, these sensitive discussions with people who are kind of considering close family marriages and genetic testing and so forth. Thank you.
Thank you. So we haven't been at the moment, mainly because the NHS guidance suggests that that's not the best approach, and that it's more one-to-one conversations with women as they are either preconception or once they are pregnant. And as part of the model that we are building up around the genetic services, that's not the approach that's recommended through that. However, we have had conversations locally around, for us in Luton, is that something we should be exploring, despite the sort of medical model not suggesting that's the best approach. So Bradford have done quite a lot of work in this area, particularly around similar culturally sensitive genetic services, and the lead for that service has also been working in Bradford, but I'm due, I think it's next week actually, I've got a conversation with the Director of Public Health in Bradford just to understand whether they've done any of that work previously or are planning to, and how that has worked, and if that's something that we could think about doing here in Luton, because it logically makes sense to do that, but there is a challenge around best practice and not being identified as being best practice for various sort of sensitivity reasons. So I'm having a conversation with other areas, and then I was going to feed that back in, and we were going to have a conversation locally around whether that's something we should be exploring, linking with some other teams across the council to try and understand and try and make a plan around that. So it's something we're considering, but it's not currently in the plan. But I think we need to really unpick that and look at that quite carefully.
Thanks, Sally. I think I'm of the belief that prevention is better than trying to find a cure. So I think if we can make people aware of what close relative marriages can lead to, and also sort of educate the community on that, then I think I would be
you know, I know you said it's not best practice, but I think I would be keen if the team could sort of explore the best way to go around that, because I do think it would have great influence within the community if that was the case. But thank you.
Thank you. And as we progress thinking around that, I'm happy to have further conversations. And if we were having a discussion about whether we wanted to have a sort of roundtable discussion and try and kind of kick around different ideas of whether that would be appropriate to do things like that or not. And I'm happy to involve you in things, in conversations, or keep you updated.
Please, yes. If I could be involved in that, that would be great. And I don't know if you can see us, but it's Councillor Alia Khan.
Yeah, I can. Yes.
And also if we can have an update when things are progressing, if that can come back to the committee.
Yeah, that's fine.
Yeah.
Thank you. Just going on what my fellow councillor Alia Khan is talking about, have we thought about perhaps using something within our family hubs that we're launching? Because that might be a platform that we could use to kind of educate our communities on the sort of, you know, the specifics of what's happening, what can be prevented and how we can prevent it, and sort of what can we as a council sort of offer in terms of for those that are already in existing marriages who are family planning, that sort of thing. So just kind of you thinking about using what resources we already have, what we're already starting out with, and how we can roll it out within our communities, because they are community-based projects. So just a thought, really.
Yeah, thank you. So the Culturally Sensitive Genetic Services is actually, so it's hosted by, linked to the NHS, but hosted by the Early Years Alliance, who are part of the Family Hub's work. So it is all connected and part of, we'll be linking it into Family Hubs as that develops and grows further. So yes, but if we do more of that, outreach and speaking to the community, that would definitely be a link we would want to use for that as well.
Thank you.
Thanks. Councillor Keynes?
Thank you for the report. To read any report about a child dying is unsettling, I think, anyway. But suicide, at what age does the record stop for being a child suicide? What age range, basically?
So I think it's 18, but I'll have to double check. I wouldn't want to sort of making me doubt myself, but I'm pretty sure it's 18. I'll double check if that's any different. Then I'll send an email to the chair and Eunice and let you know.
Really, what I'm trying to get at is when does it become an adult suicide as opposed to a child suicide?
Yeah, absolutely. I understand. So I think it's 18, but I'll double check.
Okay, thank you.
Okay, we'll go to Councillor Abbas and then back to Councillor Khan.
I just wanted to pick up from Councillor Keynes. I mean, I was surprised to see forced suicide and self-harm, and I'm just wondering whether, I'm sure we must have looked into the circumstances behind that and whether there was any learning and whether there was anything that could have been done to highlight that and prevent that. And equally, I saw at the end we've got 3 sudden, unexpected, unexplained deaths as well, which I'm assuming were investigated. And I don't know what the learning was from that as well.
Yeah, thank you. So as I mentioned, the child death panel is right at the end, looking at the whole picture and whether there's any trends and patterns and modifier factors and looking at everybody coming together. There will have been, prior to that, lots of investigation and other processes that come in, particularly on suicide. There's a whole suicide protocol and services that come in, and everybody making sure that all the learnings have come through. So the child death overview panel is really, in those cases, it's even more after the event, if you see what I mean, because there's been so much that's happened in the process around wraparound services for the family and learnings and working with schools if they need to, and all of those processes. So if we've reviewed 4 in a year, it won't have been that there were 4 in that year. They will have come from other years previous to that. And there's a lot of work around suicide prevention and making sure that the learnings are pulled in. Don't forget as well, this isn't just Luton, so this is the whole of Bedfordshire. So yes, the circumstances are looked at. The unexpected, some of the cases within this will be young people with learning disabilities. So that there'll be a sort of an element of that where there's sort of an unexpected element, but that there's a whole history to the child as well, sadly. So wherever there are learnings, that is the purpose, and looking at where things could have been done differently, or whether there's prevention that could have been brought in earlier, and that's the purpose. So yes, they will have all been looked at, and they are always very, very sad cases to be reviewing.
I was just out of interest, trying to understand how this report links in with the local safeguarding board. Does this go to them? Do they look at this? The reason I say that, I know the government published some guidance in December about working together to safeguard children. So I just wondered whether there was a link there or not, or was there something we could be doing?
So there is a link, and I sit on the safeguarding executive, and this also came to the Children's Trust Board, which has the safeguarding link to it. We did make both the chair of safeguarding and myself did have a conversation around we could probably be doing a bit more to make sure that there's a connection between the learnings. So we're going to follow up on that conversation, but there is definitely a link. And equally, where there's some maternal death analysis that's taking place, maternal outcomes analysis, we're trying to make sure that it's all linked together, and we're sharing where there's learnings that are kind of shared learnings across both.
Dheeraj, do you want to come in on this point?
Yes, thank you. And Councillor Abbas, so yeah, just to go back to that query and build on what Sally said, the working together requirements are for any case of a child who's, serious injury or death, but in this case, it's specifically death, and where abuse was known or suspected, would trigger an incident notification process to Ofsted, which then requires the local safeguarding partnership to undertake a rapid review and to consider whether or not a further learning event is required. And panel membership for CDOP and the panel membership for the safeguarding partnership, there isn't a very clear overlap between the two, and that's done on purpose to ensure that there is connectivity between the two strands of work.
Councillor Grant, did you have another?
Thank you, Chair. Sally, sorry to be pedantic. I'm kind of going to hyper-focus on the suicide point again. I just wondered if we had the data around the reasons, so whether it was whether the rate was higher in SEND children, or whether it was children that struggle with gender and sexuality, and if we do have that data, whether we have, I'm sure we do, but whether we have an action plan on how we can further prevent that. Because unfortunately, I knew someone when I was growing up who struggled with gender, and unfortunately they took their own life because they didn't have the right supports in place. So it'll be really good to know if it can be broken down, the data on the reasons, respecting privacy, and whether we have any action plan on each of those cases.
Yeah, so each individual case will have had an action plan around it. And I can't go into the detail of the cases in this, and it's very small numbers to look at trends, but each individual, there's small numbers to look at trends for the suicide cases, but each individual suicide will have had an action plan around it and learnings that will been fed back. And if there were issues around gender or mental health or substance misuse, there will be a look back and a review of things that could have been put into place in a different way, whether they were known to services. All of those elements will be looked at, and there will be an action plan that comes out of it. There's a very robust process once there's a suicide, and there will be an action plan around each one.
Thank you.
Ashish, Kadia?
Thank you. Hi. So first of all, apologies for being late to the group. And just in terms of declarations of interest, parent governor at Wickham Primary School. Thank you so much for the clear report and the excellent work done in this area. I think colleagues have asked the question that I was going to ask about kind of follow up in terms of implementing these recommendations and an action plan that would follow. So I'd love to hear more about that as they're implemented. So I'm keen then to understand if there are any barriers to implementing the recommendations. So in particular, 1.3 of your report, which is page 6. Or 124 of the member pack. So we've listed 9 there. Are there any challenges or concerns that you've got about those recommendations being implemented? Thank you.
Thank you. I'm just making sure I've got the right page in front of me. So one of the key challenges is the maternal weight issue that I mentioned earlier. So we are doing a lot of work on that, but it continues to be a challenge and it continues to come up as one of the modifiable risk factors. So as I said at the beginning, not the cause of death, but one of the factors that you have to say actually that could have been an element of a risk factor for this situation. And that ability to know that the pathway is working properly there is a challenge there at the moment, but we have a plan around it. We're doing a lot of work. We are jointly between us, Central Beds and Bedsborough, jointly funding a public health post that's specifically to look at maternity. It used to be a public health midwife, but it's going to be a public health maternity post to specifically look at some of those pathways and looking at the preconception and how we can improve things from a public health perspective in that setting. So that does continue to be a challenge, but we have got a plan around it. There are challenges around some of the wider issues like housing conditions, which everybody's working really hard on. There's a whole action plan around the damp and mould issues that have come out from the SAG case in Rochdale. There's lots of work underway. But I don't think you can ever guarantee that, it's all going to be completely perfect. So I think it's about everybody coming together to look at these issues and working in partnership. So, I think those are the key challenges really for us going forward.
Thank you very much.
Thank you. Councillor Keynes?
I'm sorry to keep harping on about child suicide. I am slightly surprised and worried that you don't know what the age range is for suicide. Child suicide is on the increase, and I think it's something we've got to really concentrate on a lot more within schools. I know my school has a dedicated officer who deals with this sort of thing. Do you get regular reports from the schools on suspected suicides or attempted suicides, or are they just passed off as, just passed off?
So to be clear, the age range for a suicide coming through to the child death panel is 18. It just, when you have those moments where you doubt yourself, but it absolutely is 18. So I do know what that is. So for the child death overview panel process, it's only when the purpose is to review a child death after all of the other processes and learnings have come into place. So very much that is just at the end of the process, and this report is about that. But for each suicide or attempted suicide, there will be a whole wraparound process around that, and including attempted suicides as well, so attempted suicides. So the child death overview panel doesn't get reports from the school particularly because that's not the role, but they would go throughout. If there was an attempted suicide, there would be a whole wraparound process around that, and schools would be very involved. So it's not part of the child death overview panel process, but that would come into play.
Follow-up question?
Well, I'm not particularly happy with that comment, to be quite honest. So who actually deals then with prospective child suicides? if you don't?
So there's a plan that gets enacted when there's a child. So public health will be involved, schools will be involved, there'll be a whole range of partners involved. This paper is about the Child Death Overview Panel annual report, so I'm not kind of, I don't have all the details to hand of exactly what happens when there's a suspected suicide, and I don't think that's the purpose of this paper, but I can bring something back, or we can have another agenda item on that if we want to.
I think that would be a good idea. Yeah, thank you.
Yeah, we can bring something on the suicide protocols.
Thank you. Dheeraj, you wanted to come in?
And I just wanted to come back on the attempted suicide query as well. So any attempted suicide under the safeguarding being everybody's responsibility protocol, so schools would have to notify safeguarding partners. So you would expect a clear referral in to mental health services and other health services, but also to children's services to ensure that there's information sharing. And depending on the degree of the attempt, we may need to, and the reasons and causes behind it, there may need to be involvement of police as well. So absolutely, for attempted suicide, there is a process, but that wouldn't fall automatically into a CDOP process. And I know this because I chaired the CDOP panel many years ago, but the CDOP process is specifically for a child who's died, as opposed to a child who attempted suicide. So I understand your query. It's just that's managed through a different process where it's an attempt and thankfully wasn't successful, will be managed through a different process.
Obviously, just a question for me, and in that obviously the purpose of this report is to give data at a point in time, and Councillor King's mentioned that it seems apparent that there perhaps is an upward trend in childhood suicide and so on. So is there should we say a report available that gives these trends, and also to track whether the plans put in place are actually working?
So there's a whole nother work stream around suicide prevention, which is a BLMK wide piece of work, and every area has a statutory requirement to have a suicide prevention plan that, again, public health are very involved in. It's led by Bedford. We have just completed for Luton our suicide audit, so there's a statutory requirement to do a suicide audit. So we've just completed that. It's all age, so it's not just children, young people. Across the trends, it's small numbers and fluctuates year on year, but we haven't seen an increase overall in suicides. The East of England overall has seen an increase, and actually I was just having my conversations this week about that and what that means for the ongoing suicide prevention funding that comes down from national. But yeah, as we've said, that's a different conversation, but there is a whole suicide prevention work stream, suicide audit, where there's a meticulous going through of coroner's data, looking at trends again. So that process does happen as well. Great,
Thanks for confirming. I don't see any other hands up, so I think our questions are finished. And again, I think the recommendation was just to review and comment on the findings, which you've done. Thanks, Sally, for answering our questions and for the report. Thank you. Thank you. We'll move on to the next item of the agenda, which is, and I can get to the right place. So item number 8, which is the education performance of different groups, which is on page 52 to 89 of your agenda. So I think that would be page 56, hopefully, of the PDF. And that's with Caroline Dawes.
Yep, thank you very much. Thanks, Chair. Good evening. So in November, we produced a report to this committee around the headline figures to do with educational standards in 2023. And this paper provides a greater analysis of performance by different groups and over time. We've looked at children achieving the key performance indicator at Key Stage 2 of getting their reading, writing and maths. And at Key Stage 4, we've looked at students who've got a higher pass in both maths and English. So we've looked at the 3-year period from 2019 to 2023 because of COVID. Okay, so there's a COVID complication there, which we're not going to rehearse. I've detailed in paragraphs 8 through 12 around the categories that we're looking at. So disadvantaged, it's around free school meals and deprivation, English as an additional language, so EAL as a factor, and then different ethnicities. We know that Luton is a super diverse town, and you can see in that table at the bottom of page 53, the proportion roughly of pupils in schools in terms of their ethnic background. So the largest group proportionally is Asian Pakistani pupils at 27%, followed by white British at 17%, Asian Bangladeshi at 13%, and so on. So if we look first of all at disadvantaged pupils, and if we look first of all at Key Stage 2, we've had final results in for Key Stage 2, and I'm pleased to say that overall pupils in Luton achieved as high as they did nationally, in fact tiny bit above, but we're in line with national, 60% of pupils. We were a little bit above national last year in 2022, but this follows quite a long tail of underperformance compared to national. So it's a real recognition of the work that our schools are doing. We want to make sure that all groups of children are improving. It's not just one group over another. So we're looking at different groups in this paper. And we can see that disadvantaged pupils at the end of Key Stage 2 in Luton did much better than their disadvantaged peers nationally. And that has been the case over a significant period of time and actually reflects achievement for disadvantaged pupils at all key stages. The gap between non-disadvantaged children in Luton and those nationally is still there, so they're still a little bit below, but that has narrowed significantly since 2019. But the gap we feel is still too wide between disadvantaged and non-disadvantaged in Luton. 13.5 percentage points we think is too wide. That's compared to a national gap of 22 percentage points. At Key Stage 4, we've got a similar picture in relation to disadvantaged pupils, in that nationally overall, or for all pupils in Luton, they achieved broadly in line with the national results for English and Maths at level 5. And the rate of improvement has been greater in Luton in secondary schools than it has nationally. Our disadvantaged pupils, we know that nationally disadvantaged pupils don't do so well. In Luton, that is still the case, but disadvantaged pupils in Luton do better than disadvantaged pupils nationally, reflecting the performance in other key stages as well. And that is increasing. So disadvantaged pupils are improving in terms of their outcomes. The pupils who aren't disadvantaged or aren't classed as disadvantaged are still performing below their non-disadvantaged peers. But again, that gap is closing, and we're continuing to target those pupils. So the gap nationally at Key Stage 4 is pretty shocking. Nationally, 27 percentage point difference between children who are disadvantaged and non. In Luton, we think it's still too high. It's much lower than that, 18 percentage points, but we're still looking to reduce that. So in terms of raising the achievement of all pupils and reducing inequalities, looking at that work on disadvantaged, we've got a significant focus on oracy and improving people's language skills, which is particularly important for pupils from socio-economic deprived backgrounds. If we look now at pupils with English as an additional language, we've done some analysis on that data which came through recently. And we know that nationally, pupils, despite the myths, pupils who speak English as an additional language do better, slightly better nationally in their outcomes at Key Stage 2. And that is the same reflected in Luton. And in fact, EAL children in Luton perform slightly better than their EAL peers nationally, as well as doing better than their non-EAL classmates. So we can see from the graphs that the proportion of children with EAL in Luton who are achieving that expected results has increased, and it's been above the national for the last 2 years. But interestingly, the children who don't speak English as an additional language has been declining. So we need to look a bit more into why that is and the factors behind that. If we look at EAL at Key Stage 4, so this is at GCSE, we can see that, again, nationally and in Luton, children who speak English as an additional language do better. They get better results. And we can see that it's proportionally the same. So in Luton as well, about 4 percentage point difference in terms of children with EAL compared to non-EAL. So we can see that the EAL pupils are doing well. In Luton, the gap is closing slightly, but perhaps not as rapidly as those children who are not who are non-EAL, who don't have English as an additional language. So there's some quite interesting pictures there. It mirrors the national picture. The next group we're going to look at is different ethnic groups, and we've done this over time so that we can look at trends over sort of 3 data points. If we look at Key Stage 2, first of all, we know, as we've said, that overall children in Luton reach national average overall. But we're really keen to make sure that that underneath that there aren't too many variations or too many gaps. So we're really trying to shine a light on this, because we know nationally over a very long period of time there have been differences in outcomes by different ethnic groups. We've looked at the 10 ethnic groups in Luton. We've looked at the DFE categories, and this is the groups that we're looking at. And the picture in Luton is very similar to the picture nationally. It mirrors the picture nationally. So the best performing group, the highest performing group nationally at Key Stage 2 was Asian Indian at 73%. That was also the case in Luton, along with Asian Bangladeshi and Asian Other. And the lowest performing ethnic group, both nationally and in Luton, was Black Caribbean, with only 50% achieving that. So you can see in Figure 9 the pattern in 2023 of achievement nationally and in Luton for those ethnic groups. It's really important, though, to take into consideration the cohort size, because small numbers can't be quite so accurately, we can't extrapolate from them so accurately. So I've put in that figure below paragraph 34, the actual numbers of children in year 6 last year of those different ethnic groups. So you can see that whilst Asian Indian, like in nationally, was the highest performing group, it was quite small, 127 pupils. And similarly, the Black Caribbean cohort is quite a small cohort, but still significant. Similarly, there'll be variations in individual schools. And what we're proposing, pending approval from this group, is that the school level data will be shared with heads along with the Luton and the national data. And we'll be encouraging head teachers and governors to look at the implications of any differences that they have in their data and looking at how that feeds into their decisions around school improvement plans and initiatives which they engage with. But I think it's also really important to maintain those high expectations in regards to groups, because it's really important that we don't reinforce low expectations of groups who traditionally underperform. And I think that's something that we're really keen to make sure our heads and governors are aware of. And we'll be looking at that through our monitoring programme. So if we look then at year 6, over time, different ethnic groups in Luton compared to those ethnic groups nationally, we can see that we know that that since Key Stage, since 2019, the outcomes nationally have fallen due to the pandemic. Luton have improved outcomes for all children throughout the pandemic, which is a real reflection on that work that schools have done. And so we're now unpacking, have those improvements been equally distributed, if you like, across all ethnic groups. So if we look at Asian groups, first of all, you can see that Asian pupils in Luton are improving over time. Asian Bangladeshi and Asian other are now above national for those ethnic groups, and Asian Pakistani are now in line with that ethnic group nationally. Interestingly, that smaller group of Asian Indian pupils have been declining over time, and that gap with Asian Indian nationally has widened. So again, we need to be looking to schools to have a look at that and wonder why. So I think in Luton, yes, we have disparity between Asian groups. I think it's to a slightly lesser degree than national, but there are still some gaps. So in Luton, only 59% of Asian Pakistani pupils achieved that expected level at Key Stage 2, which is 10 percentage points lower than other Asian groups. So there's something around looking at that gap with Pakistani pupils. So again, because we're in line with national, we're not going to get any medals for that because there's still a big gap with other Asian groups. If we move on to looking at our black pupils, the achievement of black pupils has stayed relatively steady. Black African pupils has been broadly in line with the national average, and we've closed that gap since the pandemic. And Luton's Black Caribbean pupils do better than their Black Caribbean pupils nationally, but this is still much lower than other groups, which is why I'm really emphasising we've got to have high expectations of underachieving groups. There's a small cohort of pupils who are identified as any other black, and the performance of that group has declined over time. Small numbers make it quite difficult to make comparisons, and also the categories may be a little bit different in terms of that composite group, but we will be asking schools about that. So I think it's important to look at Black Caribbean pupils. So whilst it's only a small group, only making up 2.5% of that cohort, the underachievement is significant. And we'll be encouraging primary schools to think about how they can address that, along with the achievement of those any other black pupils. Moving on to looking at our white Year 6 pupils, performance in white British and white other reflects the national picture, performing slightly below the national average for the whole cohort. So nationally, white British and white other are underperforming compared to average. I think the graphs show that white British pupils, the achievement has declined since before the pandemic, when they were in line then with their national peers. They were below national white British last year. It's a concern that because they are one of the biggest groups in Luton, the second largest group in Luton, and make up 17% of the population in schools. So understanding the reasons for this and working to address that is going to be really key for us. There's going to be multiple factors, likely to be multiple factors behind it, and we'll be working with schools on this. But impact of COVID, we know, affected groups differently, but also multiple vulnerabilities, socioeconomic factors, send attendance and so on. So we'll be looking at targeting the schools with the highest proportions of underachievement, the kind of activities we've spoken about before. And we'll be doing some analysis by ethnic group in those schools who are engaged with those interventions and those initiatives. In terms of our white other pupils at Key Stage 2, we've seen an improvement with those children. Those are mainly our Eastern European cohorts, and they're now in line with white other nationally. The remaining groups in Year 6 that we look at are mixed ethnic groups, and that's more variable. So it's changed from above national in 2022 to below national in 2023. So we need to look again at that group. Again, it's a significant group, 9% of the cohort for Year 6, and yet they're achieving 5 percentage points below. So there's questions that we need to consider around the impact of that and the reasons behind that. So again, we'll be challenging schools on that. And again, looking at targeting pupils and targeting initiatives. If we move on to GCSE and look at the achievement for GCSE for different ethnic groups, Remember that overall pupils in Luton achieved about the same as national, so around 44%. In Luton achieved maths and English at the higher grade, which is in line with national. We know there's differences in ethnicities nationally in terms of their achievement. You can see the pattern in figure 21 nationally, and you can see that the pattern in Luton roughly mirrors the pattern nationally. In nationally and in Luton, the best performing group, similar to Key Stage 2, was Asian Indian, and again, similar to Key Stage 2, the poorest performing group was Black Caribbean. So we followed the national picture last year, but it's important, I would say, to look over time, how it's going over time. So we can see that GCSE outcomes have improved for all pupils over time. And in 2023, we were in line with national for the first time. So it's rapid improvement in our secondary schools. So we really want to shine a light and see if that uplift and those improvements have impacted on all ethnic groups, or are there some that are disproportionate? Again, we need to take account of the size of cohorts. So there's a table under paragraph 56, which shows the size of the cohorts that we're looking at in Key Stage 4 last year. So the biggest group was Asian Pakistani pupils in year 11, 814 Asian Pakistani pupils, followed by the white British pupils at 552. So that sort of cohort mirrors. So if we look at the outcomes, the exam results for our Asian pupils, you can see that Bangladeshi pupils were in line with Bangladeshi pupils nationally, and it's been broadly in line since 2019. The Pakistani pupils have improved, closing the gap with national, and they were slightly above Pakistani pupils nationally last year, which is really nice for them, really good for them. We can see that Asian Indian pupils haven't really improved so much, and it's a bit sort of static. So whilst it's improved, only in line with their group nationally, but they're still performing higher than other ethnic groups. So there's things around improvements, things around achievement. If we look at the performance of Black pupils, it's more varied, and we can see from those graphs. So in Luton, Black African pupils performing below Black African pupils nationally, and that gap has widened. So that's a concern. That's a significant group, and we need to look at that. So again, we're going to be targeting those schools with the highest numbers of those pupils, and we'll be building that into our strategies. In terms of Black Caribbean and any other Black, those cohorts, they've improved more rapidly than national, and are now achieving above national for that ethnic group. But we're not going to, we're not going to take any credit for that, because it's still so low. So only 33% of Black Caribbean pupils got maths and English at that grade 5, which, whilst better than national, is still something we really need to improve. If we look at our white pupils, white British and white other, they've shown little improvement really, actually, over the last few years. So it's a bit different to some of the other ethnic groups. The white British pupils are performing significantly below national. Only 34% got their English and maths at grade 5. That's compared to 43% nationally. And similarly, our white other pupils have improved since 2019, but they're consistently around 11 percentage points lower than national white other. So that's concern to the secondary sector, and I think it's something that we really need to look at addressing. We need to address it if we're going to achieve the Luton 2040 vision. It's going to be a key part of our education and learning strategy reset. In the immediate term, we're going to be looking at the impact of those targeted interventions, particularly around raising achievement of disadvantaged youngsters, the race and conscious equality mark, and using accurate assessment to identify underachieving white British, white other, as well as Black Caribbean and Black African pupils, so that we can really put interventions in. And you've got to have high expectations to go alongside that to really ratchet those up. The mixed ethnicity cohort, again, has been quite an interesting. We've got 8% of the year 11s last year were identified as a mixed ethnicity. Performance has been below national, both for mixed pupils and the pupils as a whole. So it's another underachieving group, which we're going to be encouraging schools to look at in terms of their school improvement plans and priorities. So that's the data. So I think there's various conclusions that we can draw. We know that COVID had a huge impact on the education of children and young people, and this was also felt in Luton, but the attainment has generally been sustained in Luton through the pandemic years, and in lots of ways those gaps, many of those gaps have narrowed. Disadvantaged outcomes we know were disproportionately impacted by the pandemic, but the focus given by Luton schools on disadvantaged children mean that that learning has been maintained for disadvantaged children in Luton, and they've continued to do well compared to their peers. But we know that COVID affected different groups differently, we also know that there were differences in attainment before COVID. So I think we should perhaps put a pin in COVID and think, well, there's inequalities before COVID and inequalities now. Let's not blame COVID on anything. So I think we're really keen to make sure that as Luton standards improve relative to the national average compared to headline figures, and we're really proud of that, and we really celebrate that with our schools. We want to, we're clear from this data that it's not reflected in every ethnic group. And so we're going to be challenging schools on that. Some groups have seen a decline in performance. Some groups significantly underachieved compared to national. So it's quite a complex picture. So it's important that we're brave and shine a light on that, and don't shy away from that. And we're going to be working with our schools on that. And I think it's going to be a really key driver when we're looking at the education and learning strategy in the rest of this academic year. So the proposals are laid out in paragraph 68 onwards, and it's clear there that the Standards and Effectiveness Service, we're planning on sharing this data annually. Painful as it might be, but we will be doing this because we need to be looking to see what changes are happening. We're going to be sharing the data with the approval of this group with head teachers and multi-academy trust CEOs at their school level. So they'll have the national level for their different ethnic groups over 3 years, the Luton achievement in the ethnic groups over the 3 years, and their schools achievement in those ethnic groups over those 3 years. And we were expecting that information to inform their decisions around school improvement. And we'll be looking to governors and trustees to ask those questions of head teachers as well. We in school improvement standards and effectiveness will be using the data around disparities between and within ethnic groups in schools to inform our interventions in schools. So it will be a factor in terms of intervening in schools and categorising schools as schools causing concern. And we'll be using that as a lens when we're doing monitoring visits for schools that don't buy us back, when we're looking at our monitoring and our intervention role in schools. So that will be a key focus. We'll be brokering arrangements for school improvement and targeting schools for schools that will have got those gaps. We'll be really looking at that. And we'll be seeking out initiatives and evidence-based school improvement support in order to be able to try and challenge those gaps and reduce those gaps. And you can see the further groups in terms of actively challenging schools. And I think the other thing that we'll be looking at is working with business intelligence on introducing additional factors, particularly gender. So looking at different ethnic groups by gender, which is it's quite a big job. I've got business intelligence ready for that for next year. Get themselves up to speed on that. And also we'll be looking at ourselves in terms of, particularly around SEND and inclusion. We'll be looking at the extent to which there's any disparities in diagnosis, in allocation of EHCPs, that kind of factor. So we'll be shining light on our work as well. So the The question, I guess, that I'm posing to colleagues in the room is seeking approval for those actions and open to any questions.
Thanks very much for that comprehensive report. So we'll go to Ashish Kadia for.
Thank you. Fantastic report. Really, really clear, really detailed as well. Excuse me. So in terms of the considerations, I think, and proposals, fully supportive of them. But I think there's something missing that I think would help. Help at a council, help at a council level, and then also help if I put my governor hat on at a school level. And that is clarity on what we're aspiring for. I think you've set that out in your verbal update, but is it national average against those particular breakdown? I think we just need to make that clear. What's your target, firstly? Secondly, if you know what your target is, what would help in the breakdown of all of these? I think it's just one bit that's missing for me is what's the quantum of the difference that we would need to make to get to that target. So for example, I'm looking at just Black Caribbean, for example, and I can see here we're doing better than the average. So maybe I should pick another example. Wherever you're below the average, what is the quantum? I.e., how many would we need to go in the other direction to enable us to have achieved our overall target? I think that will help us as a council then consider where the challenges are. And then I think the third point I just wanted to make, I think, is the gap. I call it an achievement gap, maybe, amongst the characteristics and ethnicities. So whilst we may be at the national average in a particular ethnic group, I mean, the scores are so low, it's really worrying. And therefore, making it clear that, great, we're above the national average, but actually this is really, really not where we want to be as a council. So sorry, a couple of points there, but I do hope to help.
Thank you.
Really, really clear.
Thanks.
You.
Councillor Abbas, and then we'll go to Councillor Peckham.
Thank you, Chair, and thank you, Caroline, for producing this data. It's really fascinating, and I know you've gone to quite a lot of trouble. I've got a few questions, and I think the first question is quite strange that our disadvantaged pupils seem to be doing better than our non-disadvantaged, because nationally it's the other way around. Lots of schools, lots of local authorities are struggling to do stuff with their disadvantaged pupils, but we seem to be doing okay on there. But it's the non-disadvantaged who should be easier to raise their attainment and get them up. So I just wondered what was going on there, and if you could answer that, then I'll follow up with.
Yeah, I think it's a really complex picture, and our disadvantaged still underperform compared to the non-disadvantaged. There is still that gap. But our non-disadvantaged aren't doing as well as they should be, and our disadvantaged are overperforming compared to national disadvantage. And I think it's a complex picture. I think there's the category of disadvantage is around free school meals, and we know that there's a wide variation in that, and we know that children are coming from various different backgrounds with lots of different challenges. I think there's something about targeting and using the strategies that we used with disadvantaged children, which was basically saying to schools, who are they and what are you doing in terms of raising their attainment, and really using targeted and accurate assessment and forensic assessment to identify children who are underperforming, boosting up their targets effectively, so you've got higher expectations and building that in. Now, I think there's interesting to look at those schools where everyone is performing really well. All right, and there's the key factors where everyone is performing really well, and there's no gap between disadvantaged and non-disadvantaged, and it's about high quality teaching and high expectations. And it's almost as simple and as complicated as that. So schools who use characteristics to explain away poor performance, we have very few of them in Luton now. That's just not tolerated at all. I see that a lot outside of Luton. We don't have that in Luton. What we need to be doing now is making sure we've got really high expectations for all of our children. I'm not saying, well, actually, Black Caribbean, they're doing better than national. Well, that's nothing to write home about. And similarly, around our non-disadvantaged, not improving as rapidly as our disadvantaged. So there's something around that complex mix of sort of acknowledging with our schools that they can do this. The solution is out there because the schools are all good. And we've got great schools, which means that there's capacity. They've got the skills to do that more forensic approach to demographics, to groups, to characteristics, and also to assessment and that curriculum. So it's a pretty complex picture. But yes, I completely agree. Our non-disadvantaged are not doing as well as they should do, and that's been a picture for a while now.
To me, I mean, looking at that, it suggests. I know you hit the nail on the head. It's all about good, high quality teaching and learning, and if we were getting that right in all of our schools, then our non-disadvantaged pupils would be flying. So I would go back, and you may need to go into individual school level and kind of drill down. But if we were getting it right, teaching, the quality of teaching and learning was right across all of our schools, they would be flying. And I welcome the thought you talked about high aspirations. It's all fine talking about high aspirations, but how are you translating that into the schools and into the teachers? And I wonder whether this data has even been shared with them, because you're asking us to approve to share them. I was wondering why you need our approval. I would have sent this out straight away to them.
Yeah, so yes, and I guess there are other factors in some of those non-disadvantaged. So it'd be interesting for schools to look at the factors non-disadvantaged, send other complex factors. I think in terms of working with schools, we've shared this through a workshop. So it's not the kind of data from a school level. It's not the kind of data I'm going to send out cold. All right, and I can imagine I'm trying to save as ward councillors as well, people diving in. So I'll just be sensitive. I did a workshop with heads. I had about a dozen or so heads who were really interested in it. And that was really quite reassuring. And so it was a bit of a test actually to say, well, if I send this to you, would you want all schools? No, that's probably too much. Let's just have our school, national and Luton over 3 years. And yeah, actually, we can really see that would really work. And we could really start using the kinds of strategies that we did when you were focusing on disadvantage, 8 years ago. Those same strategies. So they're really positive about it. I just thought politically it was important to get, to run it past this group first. And so I'm glad I got the 2 thumbs up.
Paul, do you want to come in on that?
Yeah, just to pick up the point about why our children who are disadvantaged are performing better than disadvantaged nationally. From my experience and looking across what happens, often in many local authorities, in many schools, disadvantaged children are in the minority and therefore are not part of the core of high quality teaching learning. They're often spend time outside the classroom, whereas in Luton we're not seeing that. They are very much part of the core. And I think the other key factor from my experience in Luton schools going round is the role of the pupil premium champion in the schools. Certainly all schools have somebody who leads on the pupil premium that works directly with disadvantage to try and raise aspirations. And what I'm seeing is that person is thinking things slightly creatively. So children being exposed to sort of enrichment work, a lot of creative work, which is actually building their confidence, rather than the money going into interventions, because the high quality teaching learning is taking place. So I think that's probably a contributory factor. But I think it is worth probably exploring why our children who are disadvantaged are performing so well over and above those that are nationally. But I think those are some of the issues behind that.
Thank you for that, Paul. Carrying on, I'm just going to say 2040, our vision is very stretching. If we want to achieve that, we need to be sorting things out now. I was just wondering how many of our head teachers are actually bought into that 2040 strategy. You talked about how high expectations. I'm not sure they're being translated through to head teachers. I don't know if there's anything been done. Explain to them that in order to achieve that, we need to do significantly better than what we're doing. Looking at a lot of the graphs there, Caroline, they will look like we're a coasting local authority. A lot of them are flatlining. I see very few that are going up in having the right trend. So the idea of high expectations, I don't see being translated through to the schools. And I think that's something needs to be done. And then accountability. And what Ashley said was absolutely right. We need to set ourselves targets. Where do we want to see our schools? Where do we want to be as a local authority? And I don't know if that's been done before, but I think we certainly need to do that, because that's one way of translating our high expectations. And we should be doing that, I don't know, every 2 or 3 years. Where do we expect to be on that journey towards 24?
Yeah, absolutely, and that'll be the strategy.
I'll pick that one up. Absolutely, Councillor Abbas. We have high expectations. We're working with our schools to raise their ambitions. I think where we are at the moment is that all of our maintained schools are good or outstanding, and Ofsted view that they've got high ambitions and the quality of provision is strong. We've now got a very good baseline to now build on that to set the bar even higher. We're in the process of resetting our education learning plan for the next 3 years, and I think the very points that Caroline has mentioned tonight around really focusing on trying to drive up standards for those underperforming groups is going to be a key part of that. I'm going to be delighted to come back to Scrutiny with that education learning plan, but certainly we're taking every opportunity now to work with our head teachers. A meeting tomorrow, for example, with all of our heads from Luton coming together, we're exploring actually how do we raise the ambition, and certainly we have a passion from our heads who want to achieve the 2040 vision. What we haven't yet got, and that's partly a combination of factors, we haven't got a clear pathway for them to actually get to that point. And I think part of the education learning reset is all around working with our heads to co-create what are the steps. So in 3 years' time, we can see tangible differences. So we can set the targets and put actions in place with our schools to pull them together towards reaching those goals. And I think there is quite a lot. Certainly, our schools do buy into the 2040 vision. We had a huge conference for our schools' councils in December, where all of our schools came together with young people to share their ambitions about what they want to achieve. So schools are very much aware of that. What they're wanting now is that kind of pathway so they can really catch hold of this and know the tangible steps they can make. So that's obviously part of the next 3-year plan for us, and we're starting that work and have been already working with our schools to raise those ambitions.
Okay, thank you, Paul.
Councillor Begum.
Thank you. I have a couple of questions. First one, I wanted to just ask really about on paragraph 12, where you're talking about Gypsy, Roma and the Traveller Irish Heritage Group. You're saying that they are no longer going to be sort of included, or how are they going to be represented in reports such as this? Because they do tend to be those that are excluded quite a lot from school and therefore not represented anyway. So my fear is we're already talking about further marginalising a marginalised group. So that's my first question, if you want to answer.
Yeah, absolutely. No, and I grappled with exactly with that for exactly those reasons. And it's a statistical thing that the numbers are too small to be statistical, because remember, this is only for year 6 and only for year 11. And so as a cohort, the numbers were too small. What we've done in terms of, and it's something we could look at again next year. So I'm really happy to take on and see if we can do it in a more, in a way that will reflect that. So they're not marginalised, because of what I'm saying to schools, and I guess I'm saying the same thing to myself, and I'm arguing in the same way, that just because you've got small numbers doesn't mean you just say, oh, well, the numbers are too small. You can look at it accumulatively over time. So we could look, for example, at Gypsy Roma Traveller achievement over, on a rolling 3-year period, in which case we'll have more children. So I'll certainly be looking to BI to explore that. And then particularly around when we're looking at our SEND cohorts and looking at attendance, I think that's really key. And of course, there's nothing to stop the schools looking at that, because there'll be some schools who do have quite a significant Gypsy Roma Traveller cohort. And so because I think we're posing these questions about disparities, we want them to look at their groups and their disparities and say, well, what are we doing about these groups?
Of course, the danger then is that if we don't include them when we are comparing national averages, or if, for example, if I was to do a study and I'm trying to find particular figures just on that particular community, then already I've marginalised and left out a group of people that should really be included. And I don't like to think that a child is just a statistic. It's kind of like part of our 2040 vision is to be a friendly town. I can't see us being a friendly town if we're marginalising people. So that's my first thing. Second point is, when we are talking about the African Caribbean people about how they are underachieving. It's not new in terms of statistics wise. It's been many, many years that they've been underachieving. Because the last time I believe I looked at some figures, and it shocked me then, was about 5 years ago that we were underachieving in Luton. 5 to 7 years ago, something like that, and it doesn't seem to have improved. So we've already had 5+ years to kind of work on why is this trend repeating and repeating and repeating. So I guess my question is, if this is still continuing, it seems as if we still don't have any answers, or is it that again we are marginalising another group because they are underperforming?
I think there's something around actually shining a light on that and saying it's been going on for too long. And whilst our Black Caribbean pupils have improved compared to national, again, it's still too low. So we'll be doing something much more targeted. We'll be looking at working with organisations like the Reach Foundation and more community-based activities. And it's sort of around the numbers that your colleague was talking about. You know, let's see where the children are, see what we can do with them. Let's share things with the community. And I think there's some interesting work going on with supplementary schools, for example. So I think it's something around matching up the activities that we're doing with the schools and identified pupils, and it will take a bit of time, but our ambitions are high. We're not going to be accepting national for Black Caribbean. Absolutely.
Paul, you wanted to come in on that?
Just to pick up on that, we had the community group for Black Lives Matter in the motion the other week, and certainly this came up, and we were talking about how we engage with the community around families, because it's very much around aspiration and around sort of ways of behaving, ways of learning. And we have to work around the family and the young people to make sure that they are ready to learn, but also that when they come to school, they're having the kind of curriculum and kind of response that has enabled them to thrive. And certainly the Reach Foundation is one such organisation. They're introducing themselves to head teachers tomorrow. But there'd be a lot of work. It's not just about what happens in the curriculum. It's about trying to get that culture of learning and a culture of feeling that they can succeed, which is about building confidence. There's a big piece of work. And the Education Learning Reset very much focuses not just on what's happening in schools, but about how our communities enhance the learning potential of our young people as well, because it all has to come together if we're going to make that difference. But it's going to be a big piece of work. We recognise that, but certainly the community group that we met last week were very keen to be involved.
So to come back on you, Paul, on that, I think one of the things that you need to look at is stigma. And I hear it quite often with people of colour, that you don't want to be seen in the class as the clever kid, because then you are kind of labelled as being the geek. You know, you kind of build yourself a reputation that a person of a particular colour or a particular style, a particular look has to behave in a particular way and maintain what is their status quo. And therefore they don't want to be in that category. My son included. He is a bright boy, but he doesn't want to do well in his exams, because then he'll have to leave his friends in the current group, or he'll be labelled as teacher's pet or a geek, and he doesn't want to be seen as that. So therefore he deliberately underperforms so that he can kind of stay in that group. Because if you are a clever child, you are targeted for bullying. If you are not a very clever child, again, you are targeted for bullying. So I think there needs to be kind of like a wider sort of strategy. So perhaps when you speak to your head teachers, that's something that you can perhaps take back. Another thing I wanted to ask, so I'll ask you two more. Promise it's the last two things, but I'll ask you together. So where you've got your recommendations for number 5, how will you be measuring that? And when can we expect to see something back from that? And the other thing I wanted to kind of raise is, although your proposals sound, I'll say good and optimistic at the same time, but what are you going to do to tackle the core issues of staffing? Because time and time again, whether it is primary, secondary or FE, where I am at the minute, because I'm in between FE and uni, it is so understaffed. And I just wonder how this will work if we are asking the schools to do more when they are struggling to recruit staff as it is, and retention is a huge problem. And again, along with all of that comes funding issues. So if we're asking them to do more, they need more bodies. First of all, is the government going to be giving them extra funding? Secondly, how are we going to retain our staff and recruit them in the first place?
If I just pick that one up, certainly schools are responsible for their own staffing there. I think it's not necessarily a matter of doing more, it's about thinking differently. And I think certainly a lot of the ideas that we'll be working with our schools on is actually revising that focus, working with the community. And I think it's actually then about raising those aspirations and trying to build children's confidence. So schools have the staffing to do that, to build children's confidence, to actually work in that way, but probably need some greater direction and support. What we do in Luton is provide a significant focus on professional development. So our SENDCOs, for example, have a huge professional development, building that capacity and that expertise. And we'll be continuing to do that, and certainly working with the Teaching School Hub to look at opportunities to strengthen expertise around tackling disadvantage or the achievement of particular minority groups. So it's actually trying to get that out into the system. And I think what we find within our schools is that when people come to Luton, they very seldom leave, actually, because we see a lot of teachers growing through the system because they're passionate to get it right. What we are seeing more and more of now is our schools looking for different routes into teaching for their teaching assistants, apprenticeships, and sort of initial teacher training programs where the graduate teachers and a lot of things are happening to try and build that workforce that have that commitment to the school and that commitment to Luton. And so therefore we do recognise that there are some shortages in specialist subjects, but I know that our schools are working quite hard to tackle that. But I think all this is around trying to make sure that we've got the best teachers and the best trained teachers with the expertise to make that difference.
Any other questions? Oh, Dr. Sultan.
I'd like to add just my observation on something. The distribution of disadvantaged and non-disadvantaged group. Are you really targeting each and every child or not? Because some children, for example, children new into this country, immigrant children, as per this division, they will come as non-disadvantaged group, but they are not. Most of them are clearly eligible for the disadvantaged group, and they are qualified for different support which is available to disadvantaged students, but they are not getting that. So are we actually targeting each and every child?
So we'll be expecting schools to do exactly that in terms of identifying need accurately and meeting those needs. In terms of the measurement of achievement, disadvantaged children, as in children who've been eligible for free school meals, either currently having free school meals or at some point in the last 6 years, or they're looked after child, like my colleague was talking about earlier. That's the category of group, that's the category of pupils who are underachieving across the country. But I think in Luton, we had a real focus on this cohort because people didn't know who they were. And so that's the first thing, is knowing who the children are, who are on free school meals. Doesn't necessarily mean that we don't want to make assumptions about everyone who's on a free school meal having lots of disadvantage, but it's a measure. But no, you're absolutely right and I think our schools are pretty good at this now. Some better than others, obviously, but that's what we need to get to, where basically you're looking at all of the factors impacting on a child's progress, and you identify their needs accurately and you meet those needs and you help them get across those barriers to meet those high expectations.
There is a risk, because there is risk as an impact. What will be the impact? They won't be able to access to the higher education or job prosperity. Most of the children, which actually I have experience of working with immigrant children, so I know that some children are not getting the admission in the universities because they have some previous immigration problems due to their parents, which was not their fault, but they are waiting, they're not eligible for their admissions as a domestic student, and they need to be the international student fee, which is obviously very high for them. So it's a kind of a barrier for them. They are here, they are in the system, but they are not having the equal opportunity as other children.
I would hope that schools would be addressing that, definitely. Yeah.
Thank you. I don't see any other hands up. So the recommendations are as stated. I'm certainly supportive of the recommendations, and I don't see any dissenting voices or indications. So I think the Scrutiny Committee agrees to that. And again, thank you for your report and responding to our questions. So we move on to the next item of the agenda, which is item 9, the Children's Improvement Plan Highlight Report. That's on pages 90 to 117 of your agenda packs. That would be, I think, page 94 on the PDF. Yep, and that's with Paul Jokey.
Thank you, Chair. Good evening, all. So this is our bi-monthly update of the improvement plan. So just looking at theme 1, improving quality. So since the inception of the plan, we've closed 8 work streams, and 3 have moved to business as usual, with 9 continuing to be open and being actively worked upon. So just a couple of highlights from what we've done in the last couple of months is we have now completed phase 1 of the social work workforce strategy. And we're now looking at our alternatively qualified staff within the department, with the idea that we'll have a full strategy for the department for workforce by the beginning of June. And we're developing an implementation plan for the Mockingbird programme to further enhance our offer to foster carers, providing wraparound support. And this will also sort of support them who are supporting our children and young people with more complex needs. For theme 2, improving implementation of learning, we've 11 open work streams and we have closed 7 since the inception. We held, so the highlights, just a couple of highlights. We have held a very successful child-friendly Luton conference with Luton schools in December, with 117 pupils attending, 30 primary schools in the morning and 8 senior schools in the afternoon. Hugely positive feedback from all the young people and the schools, and this will now be an annual event, and we're already beginning to plan the next one in December. We are in the process of signing off our memorandum of understanding with UNICEF. We fed back some changes from our legal team, and these are currently being reviewed by UNICEF themselves, and we hope to sign off very soon. We have co-produced with young people an engagement plan, and we're now in the process of developing our discovery phase so that we can go live quite quickly once the MOU is signed. Theme 3, improving tools. We've got 2 open work streams, 4 closed, 4 now business as usual, 1 off target, and this is to do with eyes. We do have a recovery plan for that, and we are working on it actively. For that theme, our key highlight is we've been looking at how we manage performance and accountability, and we've reviewed our terms of reference, what formerly was PAM to a PAT meeting. It's been well received by managers and the heads of service. Theme 4, which is improving strategic partnerships. This is one of the biggest areas. We have 14 open work streams, 4 that haven't started yet, but they're long-term goals and will require more work to begin. We've closed off 17, and we have 11 that are now business as usual. So lots of work taking place there. A couple of key highlights around our offer to our care leavers. So we now provide a not in education, employment or training drop-in at TOCO, and we've got a system in place with the care leaver team, or the 18 plus team, that enables them to identify and offer support to specific care leavers. We also have adult learning in the DWP attending to support care leavers as well, which is really, really positive. The virtual school have been in contact with the BBC Big Weekender to ensure that there's some opportunities available for our care leavers to work on this weekend as well. So we're really pleased about that. Theme 5. Now, theme 5 was the new theme that was brought in around partners and partnership working. So it's been very positive from partners. We note that we have some areas that we've not quite agreed some timelines, and we're working on that with them. But we have 8 open work streams, 1 to start, 1 closed, and 2 now business as usual. So really, really positive in such a short period of time. So some key highlights from them. The multi-agency group, which is part of the LSCP, reviewed our effective support document, made recommendations, and as part of that revision, myself and the the head of service for quality assurance are now in the process of refreshing that document following that. The police have introduced a quality assurance sergeant level role in the public protection unit, which incorporates quality assurance within MASH responsibilities. And this role is just gone out to, well, it's temporarily filled. They are going out to permanent recruitment. This manager has reviewed and updated the Beds Police MASH staff training programme, and they're incorporating additional multi-agency training sessions as provided by the LSCP. The ICB are developing an options appraisal to take to the ICB exec board for additional resources to look at the health model required for MASH, which is a really good positive step forward. And they've also introduced a private healthcare provider KPI to support with all outstanding or triaging all outstanding health assessments, and a plan is in place to complete the outstanding assessments and reviews. This is currently because the provider doesn't have the capacity to support at this time. So that's the key highlights for me.
Thank you. I mean, one of the biggest challenges that is ongoing really is you know, the recruitment of staff, and I think getting that ratio of agency staff versus permanent staff down. Whereabouts are we on that? Maybe it is in the report, but I couldn't find it. Sorry.
It's not. We didn't put it into the report. I think we currently have 30.
So current ratio as of the start of this month was 28% agency, and that's an improvement from 36% agency in the summer this year.
In a good downward trend on that. That's good.
Sorry, just to add, consequently, we've increased the number of permanent staff as a result, because that's what's allowed us to reduce the number of agency staff usage.
Thank you. And my eyes were just drawn to the red on, I think it's the early years system, EYE eyes, should we say, system. I was just curious as to what the impact of this delay is, and essentially what is the updated estimated timelines for that system.
So the ICE system is a performance monitoring system. It doesn't change any of our ongoing current functionality. It's advancing the next stages of our ability to engage the social care and early years systems a bit better together. It just means, so that the current update is we've been able to launch a version of ICE that's more targeted towards education. Our next phase is to do the same for the social care side of the system. And as Paul said, there's a work program, a recovery plan in place around that.
Thank you. Any questions from the floor? Terry, are you about to put your hand up?
Yeah, mine's not really technical. I really would like to meet one day the person who thinks up these job titles. Page 101, lead officer, the liquid logic system owner. What the devil's that?
Yes, so that is the person that owns the data system itself. So the data system is called Liquid Logic. It's the system we use across social care. It encompasses, so we have the early help module, we have the eyes module, and then we have LCS, which is the social care module.
So it's basically a social worker.
No, it's a ICT specialist, system specialist.
Oh, well, that means everything. Thank you.
Councillor Abbas?
Thank you, Chair. I was just going to ask, when are we expecting Ofsted to come back and visit us again?
We are due a focused visit, and we'll do our annual conversation in sort of June time. It's usually an annual. We had one last year in June. We'd expect them to come back and do a focused visit around either just afterwards, hopefully. This year, yes. The full ILACs we would not be expecting until next year.
In light of that, I was just looking at our RAG rating is amber, at risk. Doesn't fill me with a lot of confidence if they're coming in June, which is only a few months away, and we're saying we're amber at risk.
That's particularly around eyes and the recruitment. And as Dheeraj has pointed out, recruitment is improving. We have a good workforce strategy now in place with good targets as well about how do we improve that.
Dheeraj, do you want to come in on that?
Thank you. Just to build on what Paul said, so we're expecting a focus visit this year, but we were also expecting a send area inspection, and that's Ofsted and CQC joint area inspection. It's not a local authority inspection. It will include health systems as equal partners within it, and that's graded as well. The full inspection of local authority children's services, which we think is going to be next year, but you know, it's nobody can really tell. Will be the next graded inspection. So that won't be till next year. So until such time, we remain in the eyes of Ofsted as requiring improvement to be good. And in my experience, if we keep the relentless focus on continuous improvement, as opposed to thinking we're already there, we stand a better chance. And I think it's the right thing to do to carry on the ambition.
Any other questions or comments? No. Okay. So yeah, we note the contents of your report, Paul, and again, thank you for presenting and answering our questions. So I think that brings us almost to the end. I think it's just the forward work plan remaining, which is on pages 142 to 158 of the agenda pack. That's 146, I think, on the PDF. So the next meeting is on the 19th of June, which will be after the annual full council. It will be quite a busy one, but that's been a bit unavoidable. Yeah, if anybody has any comments on that, then please do feel free to drop me an email or and again, we do have some slots in some of the later meetings after that. So again, anything that you wish to bring forward, let me know, and we can discuss that and add those to the agenda, in addition to obviously what we've raised today. Okay, that having been said, I think we can close the meeting, and thanks everyone for your input. Cheers.